This is Todd Ponsky from the Journal of Pediatric Surgery, and here's your 2-minute review. Today we have a special treat. We actually have a medical student doing our 2-minute review. This is Maria Libertin, who is a first-year medical student at NeoMed here in Northeast Ohio. Maria is going to review an article on battery ingestion that was just published in the Journal of Pediatric Surgery. Maria?
Battery ingestion is very common in pediatric patients, and while it is known to urgently remove a battery within the esophagus, the treatment plan becomes a little bit more inconsistent when it's past the gastroesophageal junction. Therefore, authors Eric Rosenfeld and Sohail Shah looked more into the whole entire process of what we do when the battery is past that junction. They published the paper, Battery Ingestion in Children, Variations in Care and Development of Clinical Algorithms. This was a 2-center study done at Texas Children's and Children's Mercy Hospital in Kansas City. After a retrospective review and a literature review, they created an evidence-based algorithm to create more consistency among providers when treating this condition. Their retrospective study showed a majority of battery ingestions past the esophagus were treated conservatively with no intervention and had no complications. Those that were treated with an intervention were either symptomatic, unable to pass the battery within an appropriate amount of time, or had other concerning ingested items such as magnets. The retrospective study also showed 2 patients needing intervention when the battery was past the esophagus, but these were patients that had ingested button batteries with a perforated Meckel's diverticulum and a gastric perforation. Their evidence-based algorithm simply states that if the patient is symptomatic, you need to urgently remove the battery. If the patient is asymptomatic, they should be monitored for 5 to 7 days with imaging, and then if the battery shows no progression, then the physician should start considering removing the battery. This is also a simplified version of the algorithm found on poison.org, for which the link is found below. This study will hopefully eliminate the amount of unnecessary surgical intervention and increase the consistency in the treatment among all medical professionals when dealing with battery ingestions in pediatric patients.
Maria, awesome job. Great review. Let me just try to summarize this. We know that we remove the batteries from the esophagus. We don't all agree on what to do when they've gone into the stomach. The gist here is if they're asymptomatic, you can send them home, get the x-rays as an outpatient, and after 7 days, if it's still there, then intervene. If they're symptomatic, you admit them to the hospital and intervene, right? There's 2 algorithms. Again, we're posting them both. There's the one from this study, and then there's the one from poison.org, and we'll have both of those algorithms here. Thank you for a great review.
Thank you.